public health is much broader than medicine. And, this sounds like something so fundamental, but it's incredible how many people still genuinely are not able to, distinguish the two things, So for people, healthcare or health is sort of synonymous with a medical doctor or a nurse, and I think just to be able to appreciate that actually public health is very interdisciplinary. You equally need a social scientist. We've spoken so much about behavioral change, ever since the pandemic has come. And I mean, for me, working in public health, this has always been something that should be a priority always. You shouldn't be telling people about behavior change only when you have a crisis, only when you have a virus which is, raging across the world. Behavior change is something we need to have in our everyday lives all the time. So you need social scientists for that. It's not a medical doctor who's best positioned to tell you how to do that. So there you need health economists. You need people who can study the, relative cost versus effectiveness of a particular intervention. We need epidemiologists. So these are people who really study diseases at the population health level, and tell us, what is the sort of natural course of this disease, what is the ways in which it's going to progress, how lethal is it going to be, what it's going to do to people. So we need those kind of professionals as well. So I think that is really the biggest message, and that's something I always give. But I really hope that this pandemic sort of makes that distinction very clear, that yes, of course you can go down the medical route, you can, do medicine, you can be a nurse, you can even be an allied health professional. So, you could choose to do something in nutrition, you could choose to do something in physiotherapy. Those are also very important, sort of professions, even though we often don't put them at par, with a medical doctor or a specialist. But we should, because they also have very important roles that, those kind of professionals play in their own way. So I think that is going to open up, once we have that understanding. Then I think it's very clear that you have a whole plethora of opportunities which are open. And of course, as you mentioned, that also now the intersection with technology, um, especially how do you make sure that, you know you have a very democratized access to this technology? Because again, what the pandemic has also shown, is a digital divide, in many cases, right? So it's not that, um, yes, adoption of technology has gone up, but it's not uniform, right? So in India also, like, while somebody in an urban area might be able to do a teleconsultation, relatively more easily, it might be much more difficult for somebody in a village or in a remote area, right? Or similarly, use of technology in education. While in our kind of homes, we might be able to give our children a tablet, or they might be able to do online classes on Zoom. It might be much more difficult for a child, in a village or in a remote part of India. So when it comes to technology, like, how do you really democratize access to that? How do you make sure that everyone has access? How do you make sure it's having that kind of impact on everyone's life, and it's not just a few who are benefiting from it, whereas others are getting even further left behind, because that's a danger, that's a real danger. So I think there's going to be a whole host of opportunities that this will open up, once we just have this fundamental understanding that public health and healthcare is not just being a medical professional. There's so many other ways, and there's so many existing skill sets that you might have, which you might be able to actually bring to this field and have a very meaningful career. So I think that sort of understanding, hopefully will now come about in a much bigger way.